it always occurred to me that wouldn't it be great to have a nasal spray version of betadine? We wouldn't be able to use the betadine brand, but we could do something else. We ended up calling it Nasodine, of course. And that was the genesis for creating Firebrick. Firebrick started in 2012, 14 years ago. It goes quickly. By Stephen Goodall and I, and with his background in chemistry and mine in microbiology and marketing, we made a pretty good combination of two experienced people who could take this forward, this project. Our mission was to create the world's first povidone iodine nasal spray, and kind of a modest ambition to create the world's first effective treatment for the common cold after, all the big pharmaceutical companies had failed. But we thought that seemed like a great idea. It was a much bigger project than we expected. It took us several years to come up with a safe and suitable product and package to deliver the nasal spray. And then we had to do all of the clinical studies to support it, which we did, and raised a bunch of money. A lot of our first investors were actually doctors because they saw this as a complete no-brainer, a betadine or povidone iodine nasal spray. And we completed all the development, and we filed patents, and we got patents granted for it in the US, Europe, Australia. And it looked like we were off to the races. And then we ran into regulatory problems in Australia. And that's basically because even though it's a topical antiseptic, the Australian authorities classified it as a drug. And that elevated the evidentiary and safety hurdle enormously. Now, the product's quite safe. We've demonstrated that even to the regulator's satisfaction, but it's a much higher hurdle on the efficacy side that I think is the major issue in Australia. We decided, though, that the idea of a nasal spray that kills all viruses is so compelling that we have to take this to the world, regardless of what happens in Australia. So we've really shifted our focus towards Singapore and the region in Southeast Asia, and we've started marketing it there, and that's where our expansion's going to be in the future. The obvious candidate for us was Singapore, where the Health Sciences Authority, the equivalent of the TGA or FDA in Singapore, said to us, it's an antiseptic. You actually don't need approval to market it. It's an antiseptic. It just works topically, provided you meet the requirements, which we did. So in early 2024, we were able to launch it in Singapore, initially online, just through an e-commerce platform we set up, and then subsequently through a distributor called Inarini Life Sciences, who've done a great job for us. And now it's marketed in Singapore in various retail pharmacies, and the doctors love it. The hospitals, all the government hospitals have adopted it in the nasal spray in Singapore, and we're using that as a conduit now to launch new Nasodine products, because we're not a one-trick pony. I mean, part of the thinking about povidone iodine's utility was, what else can we use it for? It's an incredible agent. What else can we use it for? So we developed the throat spray, and we launched that in Singapore, just 5 or 6 months ago now. So that's also available on the market, and we've got some pretty other interesting products coming through. Now, Indonesia, let me get to Indonesia. Indonesia is important because while we were able to put it on the market in Singapore without approval, for most other markets, we need a regulatory approval. Indonesia was our first actual regulatory approval where we had to submit a dossier to a regulator. They reviewed it. They didn't treat it as a drug. They knew it was an antiseptic, but they wanted to see that we were making a quality and safe product. And so we submitted that, and that was approved in 2025. And that's our first approval internationally. So that's great news. But it's also great news because Indonesia is a market of 280 million people, whereas Singapore is 6 million. And even if you take into account that only a portion of the Indonesian population is in the middle and upper middle class. And this is not a cheap product. But even if you look at that portion of the people, it's still 20 times the size of the Singapore market. So it's really quite an important development for us. And the other important development is the Philippines, because that's also similar size to Indonesia in terms of the middle and upper middle class population. So we've submitted for approval in the Philippines, and we hope it goes a similar way to Indonesia and we get approved there. If that happens, we'll have the two largest markets in the region able to sell Nasodine nasal spray.